Fillers, volume. Let's talk about it. You guys seen a lot of people coming in your office for fillers. You do a lot of hyaluronic acid, gel, biostimulatory fillers. Tell me about it.
Love the volume, of course, because as we age, that's one of the key things that happens. We lose it in really important areas. So, you can restore volume. You can use fillers. You can also use fat, which is actually my favorite because I think it has a lot of advantages for the patient. But what people are doing now, I'm sure you're seeing this, Armando, probably doing it, is microdosing fillers, sometimes in combination with Botox.
Hyaluronic acid is a great substance, right? We all have it in our skin. It attracts water, makes the skin look plump and young, and the face loses volume, as you were saying, as we get older. So putting a little bit of that hyaluronic acid back in at various depths can make you look younger and restore that volume. So yeah, it's a great product. I think the most important thing to understand, though, is that you're not really correcting the problem, right? It's a temporary correction, so it's more of a camouflage technique than it would be a permanent fix.
Right, and if you overuse it, you see people who blow up faces to try to avoid doing a lift, and that's not a kind
thing. You guys
thing.
dissolving a lot of filler in your practice?
We do see people who come in and they've been overtreated, and I think it can be a real benefit for them.
Yeah, there's been some buzz about this in the celebrity community, right? There's a few celebrities that feel like their filler experience was negative because it made them look funny. And I think that's a situation where maybe it wasn't injected as well as it could have been. You want to be careful who puts it in, where you put it, and understand that it's not permanent.
And less is more, like many things in plastic surgery.
If you have a patient who has nicely done filler, they come in for a facelift, are you talking them into dissolving it? Do you let them not dissolve it? Tell me what your approach is in that situation.
Well, I think in general, that can be rough on patients to dissolve filler, unless you have a good reason to do it. So I usually don't.
I agree.
Sometimes I'll wait.
It's hard when you're trying to hit a moving target. So sometimes I have to help my patients understand why there's a benefit to letting everything wear off so I can see what their real appearance is before we move forward.
Great, so don't dissolve, wait.
Yeah, I think that's a much smarter way myself.
Well, plus dissolving it costs some money, and it's very painful too. So, a lot of times once you explain all that to the patient, they're happier to wait too.
Infection, do you guys dissolve the filler or do you treat the infection first? Some people say if you dissolve it, the infection can spread. What's your take on that?
You want to treat the infection, of course. And I think you also want to dissolve, but the first line, at least for me, would be antibiotics and then dissolve.
In my practice, I've seen a few of these, and what I've seen is that it doesn't fully go away unless you dissolve it.
Right.
And I've never seen dissolving it spread it and make it worse. So,
no, I haven't.
For what it's worth,
either.
3 or 4 times.
But I personally get them started on the antibiotic and then dissolve, rather than dissolve and then do the antibiotic.
Great. Well, for more information, go to theplasticsurgerychannel.com.